All right, as many of our loyal listeners are aware, I work closely with seniors and their adult children on a daily basis. Sometimes I see clients with 2 and maybe 3 pages of medications. I'm talking 10 to 15 meds that have been prescribed by various doctors and specialists. Are we a society that is being over-medicated? Well, to tell us more, I have in studio with me Robert Wise, founder of Rise Anxiety and Depression Clinic, and Dr. Joan Tucker, psychiatrist at Rise Anxiety and Depression Clinic. Welcome to both of you to Life Unrehearsed.
Thank you, Matt.
Well, thanks for coming into the studio. Dr. Tucker, a special thank you to you. You live in Toronto. You came into Montreal. Glad to have you here in studio. Really do appreciate it. You are McGill grad, though, from what I understand.
I sure am, yeah.
Good for you. All right, well, let's get right into it. So, Dr. Tucker, how do you know if your medication is working the way it should?
Well, that's a really great question, because when I'm going to answer this specifically from mental health, which is my specialty, of course. And it's really important to be sure what your diagnosis is, and not only your diagnosis, but what is your most bothersome symptom. There's a lot of symptom overlap across diagnoses, so people can have poor concentration and attention in depression, in anxiety, in attention deficit disorder, in dementia. And in order to know if your medication is working, you need to know what symptom you're addressing. And if you're not feeling better with whatever it is the symptom was that you went for help with, then it's probably the wrong medication. And you should go back and see your physician and reassess.
It's interesting because, one, there's an issue of us even having a physician. And then there's the other extreme where you've got a physician, you've got a specialist, a cardiologist, and it goes on. And then all of a sudden, we have all these medications. So in your opinion, broad stroking it, do you think we're a society that's being over-medicated?
Okay, I'm going to answer that question from 2 domains. One is geriatric, which is specifically to what you're working with. And for sure, geriatric patients do come in with pages and pages of medication. And the question is why? Well, first of all, they don't see one consistent doctor. Nobody has discontinued the medication, so the pharmacy is still providing it because they've gone to a different doctor. They've often got bottles of those medications in their pharmacy cabinets at home, and nobody is disposing of them. So it's really important, if you do have an elderly person who's not using their medication, to please bring it back to the pharmacy for disposal. And then finally, we have to remember that as we age, most of us lose some aspect of our cognition. And so what that means is we're not concentrating as well, and we make mistakes when we take our medications. Even myself, I'll forget to take vitamins, for example, that were prescribed. And so nowadays, I actually ask all my patients who are on more than 1 or 2 medications to get it in a dosette from the pharmacy. So they know exactly what time and which day to take their medication, and there's no question of whether you took it or you didn't take it.
Great idea. We call them dispill packs here too in Quebec, and I think that's one part of the solution. Listening to Life Unrehearsed here, Matt Delvecchio, and I'm talking with psychiatrist Dr. Joan Tucker and Robert Wise, founder of the Rise Anxiety and Depression Clinic. I just quickly want to go on to, we've had several pharmacists on Life Unrehearsed. And at some point in time, I have a lot of adult children, the daughter or the son, saying, look at my mom's meds or my dad's meds. This is craziness. And you mentioned, doctors aren't, canceling prescriptions. Can your local pharmacist play a role in help managing these meds as well by taking a good look at them?
Yeah, but pharmacists still, for the most part, rely upon the orders from the physician. So certainly they can let us know, and they're very helpful to us as doctors to let us know if there's interactions, if one medication affects the metabolism of a second medication. So if you take it, the dosage is going to be actually higher in your system. The best thing that the pharmacist can do is call the physician. I get calls all the time. Hey, did you mean to prescribe this? Did you know that the patient was actually on that? And that happens to me sometimes. I'm like, you know what? I didn't know the patient was on that because he didn't tell me. So the pharmacist has that information. And if there's a great dialogue and communication between pharmacist and physician, that's in the best interest of the patient. And I've got great pharmacists calling me, and I'm really grateful for that.
Another question that I get often is, sometimes the side effects outdo the benefits of the medication. It almost becomes overwhelming, and you may not even know if the medication is stopping to work. And so what happens? What should you do if you all of a sudden the side effects are overwhelming for you?
Okay, so let's back up again and speak just from the position of psychiatry. So all medications have side effects, period. But not all people have the same side effects. It's very individual. So whereas a side effect may be, let's say, headache and nausea from a typical antidepressant in one person, the next person may only have sedation. The next person may find it agitating. So step one is I generally like to go over the most common side effects. Of course, there could be like 100 side effects, but I go over, let's say, the top 3. If side effects are preventing you from taking your medication, our clients and patients at Rise Clinic know that they let us know right away, and I hop on a call with them and see what's going on. Sometimes side effects work to our advantage. For example, some antidepressant medications are sedating, and if a person isn't sleeping, we suggest taking it at bedtime, so that'll help them to sleep. If a person isn't eating because they've lost their appetite because of depression, some of the medications increase your appetite. If a person is smoking, for example, we want them to quit smoking, some of our medications reduce the urge to smoke. So we like to use the side effects to our advantage when we're treating. Again, all of these are dialogues with your physician. If you're having too many side effects and no benefit from your medication, it's the wrong medication for you, period.
Great words of advice. We're already out of time. Robert, I want to bring you in very quickly. You know, you've had you on the show several years ago, and we touched base about a couple of weeks ago. You are right across Canada now, aren't you?
We are across Canada. We have in-person and online available sessions in Edmonton, Vancouver, Halifax, Montreal, Toronto, Ontario, and we're keep on growing. And Joan could actually see clients virtually all over Canada.
Wonderful. Well, listen, I want to thank you both for coming into studio.
Matt.
Dr. Tucker, thank you for your words of advice. Really appreciate it. If our listeners want to get a hold of Rise Anxiety, where should they go?
I recommend that they go to our main website, www.riseclinic.ca, riseclinic.ca, and that will lead them to all of our locations.
Wonderful. Thank you very much. It's Robert Wise and Dr. Joan Tucker from Rise Anxiety and Depression Clinic. Thank you to both of you.